When you're treating persistent, hard-to-heal or complex wounds, you need a solution you can trust, like Dakin's Wound Cleanser. Just how powerful is it? Dakin's Wound Cleanser has been proven to kill even highly resistant bacteria like MRSA and VRE within only 30 seconds. It's non-cytotoxic, shelf-stable for 2 years, and more cost-effective than other wound cleanser brands. When you need a solution you can count on, ask for Dakin's.
Hello, everyone. Welcome to our podcast. Today, we have a very special guest, Corey Heerschap, to talk about his paper that is going to be published in December issue of the Advances. Corey is a wound specialist at the Royal Victoria Regional Health Centre in Ontario, Canada. He's actually currently pursuing his PhD study as well. His paper actually focused on the lived experience of patients with an ostomy and explore the effect of ostomy pouch opacity. So welcome, Corey.
Thanks so much, Kevin. Thanks for having me today.
Nice to have a chance to chat with you again. I'm curious about what gave you the idea to explore pouch opacity as an issue.
So that was actually the most interesting part of the story. I was having a sit down because I was talking with some of our surgical staff team, and they were talking about how it would be much more convenient to start using transparent pouches in the postoperative period to make it easier for the staff to do assessments of the stoma in the immediate post-op days of surgery. And one of the concerns I had was, how is that going to affect the patient who is seeing the ostomy after surgery? I know that there are post-op pouches that come transparent and allow easy access to the ostomy, specifically for the purposes of being able to easily assess the stoma. However, for a number of years now, we had actually been using at my facility opaque pouches where they're windowed, so you can actually lift the top portion of the pouch to do your wound or to do your ostomy assessments. However, for the rest of the time, the pouch is actually covered. So if patients are looking at the area of their stoma for the first time, they're not experiencing everything all at once, and they can take it in kind of on their own time. So it was interesting. I was sitting down with our unit manager at the time, and she was telling me about how they were looking at possibly making that change. And I was saying, well, I'm not sure about what the impact of the patient would be for that. And so we decided that it would be best to actually conduct some research, because there was nothing out there previously that we could find that really talked about the difference of pouching systems in the immediate post-op period. So I was lucky enough that there was an opportunity to get some funding. So I was actually able to get a research assistant who actually became the co-author of the study, a nursing student who was very interested in wound and ostomy at the time. And we decided to take on this study to see what exactly the effects of ostomy pouch opacity is on that lived experience of the postoperative ostomy patient.
Excellent idea. I think we need more research in this type of patient population. As you may be aware, when you look at the literature, there's very little evidence out there to inform practice. So I'm curious about the finding from the interviews that you have with the participants in this study. What conclusion can you draw on, and what are the implications for practice?
Yeah, so that was actually very fascinating. I was actually very, I'll say, surprised by the outcome of the majority of discussions and interviews that we had. So, as you know, with a qualitative study, really we're looking at seeing what's out there, what people's lived experiences are. So we have a smaller population where we're doing our in-depth interviews with the participants. And unsurprisingly, we got a very mixed reaction from different participants in the study. Some participants, they weren't really worried, actually. In our findings, we have a whole section talking about undercover, where a lot of patients discussed how, because they're using, for example, hospital blankets, or they have a shirt or a gown over top. Nobody in that immediate post-op period outside of the nurse is usually going in to assess the ostomy. And so because of that, because the family hasn't really got involved yet, because there's no intimacy considerations in the immediate days post-operatively while the patient's in the hospital, it didn't seem like in a majority of cases that this was a major concern for participants, which I found very surprising, actually. However, we did have a number of participants that did say that they were glad that they had that opaque pouch where they weren't able to initially see through it, because they had a very hard time managing that experience of the body change and having the stool coming out on their stomach into the pouching system. So from that experience, it was quite interesting, because what the study really showed us is that there is that mixed perspective. And I'll tell you in a minute why that really affected how we were able to implement the findings. But I did find it interesting the number of individuals who were not concerned about their ostomy, and it really pointed to the need for further research in this area, because when we start looking at the generalizability of study findings, it would be interesting to see how many individuals that it doesn't necessarily affect as much as I thought it did or thought it would, in terms of that negative aspect of having to deal with this really quickly up front, where they have to deal with these body changes and experience having this ostomy for the first time, where it's right there visible. But I thought it was quite interesting. And when we decided how exactly we were going to implement or take the findings of this study, we actually decided to continue with our opaque windowed pouches. And the reason being is because, as you know, without that generalizability of study findings, we really can't say whether or not a large majority of the population are going to be able to not mind having a transparent pouch in the post-op period, but the fact that there was that experience of appreciating the opaque pouch in the post-op period meant that we wanted to make sure that we could tackle everybody's different experiences and have something to support each one of them. And the nice thing with the windowed pouch is that you could still assess the stoma and still see what's happening inside the pouch without actually having to remove the entire system, whereas it's also still possible if they have the discussion with the patient doesn't mind, they can actually take off the covering of the pouching system so that it is a transparent system. So it just gives the nurses and the all the other team members the opportunity to have the discussion with the patient to determine where they're at and what they need in that immediate post-op period.
Excellent. Thank you, Corey. I think perhaps because of the preoperative teaching that is done by people like yourself with the special knowledge and attention paid to patients preoperatively, maybe they have mitigated a lot of anxiety and questions and concerns after the surgery. And that could explain why people may not have a lot of issues and questions about the type of pouches they're wearing.
Yeah, I think that would make for a very interesting follow-up study, actually. It hasn't been too long since we actually opened up here at Royal Victoria Regional Health Center a new outpatient ostomy clinic where I'm now following patients preoperatively. We're getting them marked prior to surgery, and I'm doing some education with them so that they're understanding what it is that they should expect, and I'm showing them the pouches and giving them an example and sending them home with a preoperative kit where they can actually practice their ostomy change ahead of time. Whereas some of our emergency cases don't necessarily get that at this period. So it would actually make for a very interesting follow-up study to determine if that preoperative education has a significant outcome in terms of how comfortable they are with the ostomy and the ostomy appliance in the post-op period, and how interested they are in the stoma versus how long it takes them to get comfortable. And I think that would make for a very interesting study with the some of the quality of life tools and instruments that are out there that we're just starting to see pop up more in guideline usage, such as the new RNAO guidelines in Ontario have now made that recommendation in their international guidelines to look more at the quality of life tools and what the patient's quality of life is. So I think it would be interesting to look at how exactly some of that education is impacting that, and if quality of life is indicative of not necessarily having to overcome as much in terms of the stress and the negative experiences of having that ostomy in the post-operative period.
Great. Thank you so much, Corey. I think it's a great paper to read, and it's so nice to be informed about the type of care that people are receiving. And I think there's a lot of implication in terms of understanding the effect of the financial impact, the type of self-esteem issues that people experience when they have to wear a pouch. This fascinating paper. So I thank you so much for publishing this interesting study. I look forward to hearing more about your future studies. Thank you so much for talking to us.
Thank you so much for having me today, Kevin.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Advances in Skin and Wound Care Journal, or Wolters Kluwer.